Right now, millions of older adults are taking medications that could be silently destroying their hearts. And here is the shocking part. These are not illegal substances or experimental treatments. These are common drugs sitting in medicine cabinets across the world. Drugs that doctors prescribe every single day. A growing number of cardiac surgeons and cardiologists are now sounding the alarm. They are seeing patterns in their operating rooms that they cannot ignore. Hearts that should be relatively healthy for a patient's age are showing damage that seems almost impossible. Inflammation markers are through the roof. Heart muscle is weakened. Rhythm problems are appearing out of nowhere, and when they trace back the medical histories, they keep finding the same culprits over and over again. The research is finally catching up to what these surgeons have been witnessing firsthand. Major studies from institutions like the Cleveland Clinic, Johns Hopkins, and the European Society of Cardiology are now confirming what many suspected. Certain medications that millions of older adults take regularly are causing measurable documented heart damage. We are not talking about rare side effects that happen to 1 in a million people. We are talking about significant cardiovascular risks that affect substantial percentages of users. Some of these drugs increase heart attack risk by over 40%. Others double or even triple the chances of developing dangerous heart rhythms. And the most alarming part is that many patients have no idea they are at risk. But there is one drug on this list that stands above all the others. One medication that cardiac surgeons are now calling the silent heart killer. The research on this particular drug is so alarming that some experts believe it should carry a black box warning, specifically for older adults. A massive study involving over 500,000 patients found that this drug was associated with catastrophic cardiac outcomes. And the worst part is that alternatives exist that are far safer. But before we reveal that number one drug, let me walk you through the complete list so you understand the full picture of what could be damaging your heart right now. Before we begin, let us know in the comments now your age and where you're watching us from. We read and reply to every single comment, so drop your comments below. Now, without any further ado, let's get started.
Number 7. Proton pump inhibitors. You probably know these drugs by brand. Names like Pyloc, Nexium, and Prevacid. Proton pump inhibitors, commonly called PPs, are among the most prescribed medications on the planet. They work by reducing stomach acid production, which helps with acid reflux, heartburn, and ulcers. For short-term use, they can be incredibly helpful. The problem is that millions of older adults have been taking them for years or even decades, and the heart-related consequences are now becoming impossible to ignore. A landmark study published in the journal PLOS One examined data from nearly 3 million patients. The researchers found that PP users had a 16 to 21% increased risk of heart attack compared to non-users. That number might not sound dramatic at first, but when you consider how many people take these drugs daily, we are talking about hundreds of thousands of additional heart attacks that could potentially be linked to PP use. The mechanism behind this damage is fascinating and terrifying at the same time. PP is appeared to reduce the production of nitric oxide in the cells that line your blood vessels. Nitric oxide is absolutely critical for cardiovascular health. It keeps your blood vessels relaxed and flexible. It prevents blood clots from forming. It protects against inflammation. When nitric oxide levels drop, your arteries become stiffer. Blood pressure rises. The risk of dangerous clots increases dramatically. Another study from Stanford University found that PPs were associated with a doubled risk of cardiovascular mortality in patients with coronary artery disease. The researchers were so concerned by their findings that they recommended physicians reconsider long-term PPE prescriptions, especially for older adults with existing heart conditions. The good news is that many people can manage their acid reflux with lifestyle changes and safer alternatives. Losing excess weight often dramatically reduces acid reflux symptoms. Eating smaller meals and avoiding food within 3 hours of bedtime helps enormously. Elevating the head of your bed by 6 in uses gravity to keep acid where it belongs. For those who still need medication, H2